Welcome to this video on electrical therapies, cardioversion and defibrillation in the emergency department. This material is based on the Tintinalli and Rosen textbooks. Let's review the core concepts. For patient safety, it is critical to understand the fundamental difference between synchronized and unsynchronized electrical delivery. Cardioversion is synchronized, timing the shock with the R wave to avoid inducing ventricular fibrillation. Defibrillation is unsynchronized, delivering a high-energy shock immediately, used when no organized QRS complex is present or in urgent clinical situations. Immediate indications for defibrillation include ventricular fibrillation, pulseless VT, and torsades de pointe. Tintinalli emphasizes that time to shock is the most critical determinant of survival in VF. Cardioversion is indicated for unstable atrial fibrillation causing symptoms, atrial flutter, and stable SVT when medical management fails or instability arises. Optimal pad placement ensures current passes through the maximum amount of myocardial tissue. Anterior-lateral is standard for arrest. Anterior-posterior may be superior for atrial fibrillation because it provides better energy delivery to the atria. The top ED error in cardioversion is failing to engage the sync button, which can trigger ventricular fibrillation. Always re-engage sync after every shock, as most devices default back to unsynchronized mode. Cardioversion is painful. Procedural sedation and analgesia are mandatory unless the patient is in extremis. Common agents include etomidate, propofol, and fentanyl. Review the recommended biphasic energy settings for various rhythm types, such as 120 to 200 joules for atrial fibrillation and 200 joules maximum for VF or pulseless VT. Common pitfalls include a low-amplitude QRS that prevents synchronization. Place pads at least 8 centimeters away from implanted pacemakers. Shave excessive chest hair or dry moisture to reduce impedance. Biphasic waveforms are superior to monophasic. Evidence shows biphasic achieves higher conversion rates with lower total energy, which reduces myocardial damage. Thank you for your clinical dedication. Please find my contact information here if you have any inquiries regarding this video. This scene lists the image sources used throughout this video.